Hi guys, welcome back to the second part of this video where we're discussing about lipids, cholesterol, triglyceride or fats in the blood. Okay, so watch the first video if you haven't done that about cholesterol. So in this video I'll be speaking about the workup, the treatment plan, and the food, healthy natural food you can implement in your daily diet to help put your cholesterol or your fats on the check. So let's start with the workup. So if you're 20 years and above, you should know your number, your triglyceride, your LDL, which they call the bad cholesterol, your HDL. You should know that. You should know your total cholesterol. Okay, we always want that to be below 200. Okay, so if you don't know your number from 20 years upward, you should know your number. Remember, this plaque buildup, or when the cholesterol goes out of border, or it's usually starts building up over time because of the way we eat, our activities, our behaviors. Okay, so we have to know our number, and once you check your number, do not freak out if it's abnormal. I know the controversy on cholesterol medication. I see a lot of my patients, when I prescribe cholesterol medication like the statins, they say, no, I'm not going to take it. I don't want to lose my memory. I truly understand. They made their research, so I have to work and partner with them. I'm not going to force that medication on them. No, I'm going to work with them to see how to bring those numbers down, which is what you should do if you don't want to go on the medication. But make sure that your primary care provider is explaining the risk and the benefits of not taking the medication, because there are other things your primary care provider will be looking at. Okay, so say I have a patient who has abnormal number. I am not just gonna write a prescription because I see the LDL is like 150. I'm not just gonna write a prescription, go start cholesterol medication. No, we have a calculator called the ASCVD, atherosclerotic cardiovascular disease calculator, that we use, so that we bring in all the risk factors. We look at your age, we look at the LDL, we look at the HDL number, we check if you're smoking, we check the blood pressure, if you're on any medication for diabetes or blood pressure. We look at all that. Those are risk factors. I look at that and then determine if I would start you on a cholesterol. So we're actually looking at the risks of someone having a stroke in 10 years time, the risk of someone having a stroke or heart attack in 10 years. If the number is say within 5 to 7.5%, I look at the risk factors before speaking to the patient and say, this is why I need to start you on a cholesterol medication. If it's above 7.5%, I also look at the risk factor and tell the patient, hey, this is your risk of having a stroke or heart attack in 10 years. And I need to put you on this. Let's work on the number and then work on your lifestyle also, and then we go from there. So don't just back away when your doctor says I need to put you on a cholesterol medication. They have to look at other risk factors for them to put you on that medication. Okay, and they have different types of statins that will work for you. They'll know which one is better for you, and they will have to check your liver function test to make sure you're able to tolerate that medication. Your liver, don't let any doctor put you on cholesterol medication if you don't know what your liver function test is, okay, or function result is. And then another workup again is there's what is called calcium score, coronary calcium score. They also look at that also. Like some of my patients, when they argue and say, no, I don't want it, I refer them to see a vascular doctor. That they'll do, especially when I see the risk for stroke and heart attack is high, I make a referral for them to see a vascular doctor. So the vascular doctor then will work from there, do the calcium score, maybe do other cardiovascular tests like EKG, stress tests, and see, and then explain to them, and that way they'll be able to know why they should go on that medication, especially if they're not working on their lifestyle. So what I do, if I don't want to put them on any medication, is we start working on lifestyle medication. That's what I go to first. So I look at the patient, check for metabolic syndrome. Is your blood pressure controlled? If they have diabetes, what's their A1C? Is it controlled? Are they pre-diabetic? Are they overweight? I look at that. Do they have belly fat? I find out if they exercise or if they are active. I find out what kind of job they do. Are they stationary most of the time? How many steps do they take in a day? I look at like their sleep, at their stress level. And then the big one, I look at the food. I look at the food. I tell them to give me like a 24-hour food recall, what they eat in a typical day, the kind of oil they use. Remember, we talked about inflammation. You need healthy foods, things that can improve omega-3 fatty acids, very healthy for the artery. So I look at the kind of food they eat, where they get their food, if they smoke, if they take alcohol. I look at all that. So before I even maybe tell them to go back, in 4 weeks they come back, we check the level. If they're not doing well, and I check the ASCVD risk factor again, if it's high, I put them right away on study. And most of the time they agree if they're not doing very well. So let's talk about the food. Let's talk about the food. Remember I said nitric oxide is very good in opening your blood vessels. So opening the blood vessels, food high in nitric oxide. Number one, beets. If you've watched my video on erectile dysfunction, beets or high blood pressure, beets opens your arteries. Beets, pistachios, leafy green vegetables, rich, superfood vegetables rich in chlorophyll like spirulina. We have almonds, our nuts and seeds, remember, are very high in omega-3 fatty acid. We have the citrus fruits. We have the pomegranate. We have our healthy fats, your omega-3 fatty acids. You need less of omega-6. Okay, what you need is your omega-3 fatty acids. You get a lot in your nuts, in your olive oil. You get that in your avocado. So healthy food, go back and watch my videos where I talk about diet, food that are anti-inflammatory, foods that are anti-inflammatory, and then stay away from foods that cause inflammation. They will damage the walls of the artery, and that way cholesterol can go there and build its space or home. All right, and deposit will go there and pile up over time. They clog the artery, and someone can have chest pain, angina, heart attack, stroke. And no processed food. Stay away from processed refined carbohydrates. Stay away from those white rice. Stay away from sugar, number one. Stay away from sweeteners, artificial sweeteners. Stay away from other refined carbohydrates like French fries, those unhealthy snacks. Stay away from fried foods. Stop deep frying your oils. Stay away from that. And you can have your egg. Egg is a healthy protein. And there's this controversy over egg, that the cholesterol, it has nothing to do. Remember, your body produces about 3,000 milligrams of cholesterol, and just a little egg like that cannot affect your cholesterol level. Remember, it's not just about the LDL. There are other things going on. LDL cannot take the blame alone. Okay, so your habits, make sure you're active, you're exercising. If you're smoking, work on stopping smoking. Okay, and what else am I missing? Okay, I talked about your Watermelon, very good in nitric oxide. I don't know why I forgot that. Herbs and spices, cilantro, oregano, your herbs and spices are very good in opening up your blood vessels, improve boosting nitric oxide. Citrus food, pomegranate, I talked about that. And sometimes you have to Google search foods rich in nitric oxide, especially right now if you're already having some symptoms of what we call atherosclerosis, which means there is plaque buildup. When you have, if your doctor has already diagnosed that you have atherosclerosis, which means sometimes you have pain, like when you do some amount of walking, maybe run, you begin to have a chest pain, or even it gets worse when you just lay down at rest and you have that chest pain. It means the blockage has increased, so that needs immediate attention. That's why when you hear people, if they want to have like a heart attack, they first hold the chest. That's because of the occlusion, the blockage. Remember I showed you guys, that's because the plug or the deposit has clogged or blocked the artery. So now blood carrying oxygen is not reaching the heart. So they are holding their heart and in pain, and the next thing they collapse. And we hear about sudden death. If they survive it, they take them to the hospital and open up the artery and do like a surgery and open up the artery, maybe put in a stent to make sure the artery is open. Some people, when they walk, they feel pain behind their legs here. That's also an example of blockage of artery. It could be in the arm. Some people, like for stroke, when it clogs or blocks the artery, you hear people, they have this serious pounding headache. So if you have like an abnormal pounding headache, that is very unusual from what you normally have. That could be a sign, especially if you have history of high cholesterol or high blood pressure or even diabetes. So you see, you have to work on both blood pressure, cholesterol, diabetes, but metabolic syndrome. All right, let's work on that. But number one, work on your diet. Diet is medicine. Remember, food is medicine. Begin to work now on your diet, on your behaviors, exercising, being active. You don't have to go to the gym. You can take walk. Remember, your 10,000, 5,000 to 10,000 steps will go a long way. Okay, so I hope you enjoyed this video of facts. If you have any other question, I need you to go ahead and ask me. And again, because the topic cholesterol is very controversial, if you have any concern, make sure you can ask me, or you can follow up with your primary care provider, especially about statins, the medication we use in treating high cholesterol. If you have questions, do not stop your cholesterol medication without consulting with your primary care provider. They will work with you to see what is better for you. Do not do that alone, okay? This is just to educate you, especially in the area of lifestyle modification, so that you can improve your health and get your cholesterol under check. All right, so please like, comment, share, and if you haven't subscribed, do subscribe to my video, and then when I put up any video, you will get the notification. Click on the bell button. Okay, do have a blessed day.